Hey, I want to share something with you. This is for business owners. This is for all business owners, but really bigger, okay, bigger businesses. It's going to have a huge impact. So particularly if you are running a business where you're spending a significant amount of money on your healthcare premiums, that's becoming a bigger, line item in your P&Ls and stuff, and something of concern. This is for you. If you're a CFO or HR person in a little bit larger company that where healthcare expenses and stuff are becoming a significant cause of concern, cause for concern, then this is for you. Okay, so what I want to take you through is a little bit different way of thinking about how you're delivering care and taking care of your team employees. So, a little bit of background for those who are just curious. Healthcare expenses have largely shifted in the private sector anyway over to the employer, meaning that what is generally called employer self-funded plans. So the employer, instead of paying a premium to an insurance company and the insurance company taking the risk on all of this on the spend, the employer has a escrow account, a bank account, a bucket that they put either their work comp expense or their healthcare expense or both, like in separate buckets. Um, you know, that then ends up paying the medical bills for the patient. So instead of a true premium, they have to keep a reserve amount, if this sounds familiar to you, right? And then write a check into that each month to make up for what the spend was to maintain the reserve amount. So for this to make sense to you, I want you to break down and think about what your musculoskeletal costs are and how many employees you have. So musculoskeletal costs generally, and you can look at your own data, but generally you're going to be somewhere around 30% or upwards, as high as 40%, but around 30% of your total healthcare spend. So in other words, if you're spending $1 million a month on on the healthcare expenses for your employees and staff, then 300,000 of that roughly is going to be on musculoskeletal. So in musculoskeletal, we're lumping in everything with an orthopedic musculoskeletal type diagnosis. So injections, MRIs, surgeries, PT, physio, all that stuff is going to end up being roughly around 30%. So we're talking about big chunks of money here, right? And every year they go up. So they're going up 5%, 10%, 3% or whatever. Now, the thing that's significant about that is when your company took on that risk, that responsibility, when they took on having those buckets, right, other bank accounts that you're paying out and you have to pay into to backfill, you likely have an administrator who used to be an insurance company, okay, like a Cigna, Aetna, UHC, whoever is administering that. And most of the advice, much of the advice you're getting from them is the way they used to do it or the old way. But I want you to think about the incentives that they have. Because if your spending goes up, then so does their revenue. Okay. If your spending goes down, so does their revenue. Right. So I want you to think about how they're compensated and how this lines up and consider why you might not be able to cut your healthcare expenses by a significant margin. So what I'm going to show you right now and what's mapped out here is a massive savings on your healthcare spend because you can cut with this clinical pathway that we'll walk through in a second, you can cut your healthcare expenses, your musculoskeletal healthcare expenses by a third. So if you're spending 30% of your total on musculoskeletal and you cut that by a third, you can chop 10% off your total musculoskeletal spend. And I'm not just saying this out of some, oh, yeah, I think you can do it. This has been proven. This has been shown. I can give you resources. Just hit me up, sturdycoaching.com, right? You can hit me up or leave a message here, whatever. And I'll send you the research, but the research and the pilot studies and all that, that's already been done. And this is not getting out there because of the way their information is passed and the vested interests that are involved and what have you. So anyway, a traditional clinical pathway. So I want you to think about your current timeline. If somebody needs to see an orthopedic surgeon, okay, how long does it take them to get there? So, the way things work right now, somebody gets hurt, and it doesn't matter, by the way, if they're playing softball on Sunday and sprain an ankle, or if they get hurt at work lifting, or start to develop carpal tunnel and tingling symptoms or whatever. It doesn't matter because they go to their primary care doc, and I don't know what all the stats are, but I know in back pain, about 50% of people go to their primary care physician. So 50% don't. meaning they go to a chiropractor, acupuncturist, or get a salon pass or take their own medication or whatever, get advice from a friend, I don't know, but they don't even enter the medical system. Okay. 50% that do go to their primary care doc. The same thing's true. I don't know, again, don't know what the percentages are, but same thing's true for ankle sprain and shoulder, injury and all the other things that go wrong. Um, but then they wait a little while to get to their primary care doctor. Maybe they go to urgent care and get given some meds or something and then told to go to their doctor. And then they get referred to an orthopedic surgeon or someone. They may get an injection, they may get tests, they may get an MRI or x-rays or something along the way, all of which cost you money, right? You're paying for it. And then they finally get to the ortho surgeon, and it could be, 4, 6, 8 weeks later since the injury before they get there. And then if they're not a surgical candidate, what does the ortho doc do? They might give them medication, but most orthodox don't want to medically manage people, so they send them back to the primary care doc and or send them to a physical therapist, right? So they refer to a PT. It's a great source of referrals for PTs. Orthodox are a great source of referrals. However, most of the patients, if not all, have been in the pipeline for weeks, okay, before they ever get to see a therapist. So what's the severity and how progressed is the problem at that stage if it's taken them weeks to get to the end treatment? Okay, so this is how you short circuit that. You, if you're in HR, the CFO or owner of a little bit larger business where you're seeing this as a significant line item right on your P&L rather, you contract with a PT provider, and there's some national ones and they're locals, and there's everybody you can think of who can do this. Not a lot of them are doing it. So if you want connections, and this is not something I'm selling, I don't offer this. It's just the right thing to do, and I'll explain why that is in a minute too, aside from just your cost savings. But if you get them into a PT first, you can short circuit that whole continuum of care that costs so much money. Okay. And a great way to do this is to be like have an on demand telehealth offering where somebody gets hurt, they sprain their ankle yesterday, they call and get a time to meet with a PT online, 15, 20 minutes. And this is just a triage appointment, right? This is not full on care, a full evaluation or whatever. This is advice. This is the same stuff that as therapists we do when our nephew calls us, right? Or brother-in-law or somebody. And niece is hurt at volleyball or lacrosse or something. You get called and it's like, okay, tell me what's going on. Here's what you should do about it. So advice and tips on what to do so that they don't panic and all, that's perfectly viable during this telehealth visit. Advice and follow-up and with an online home exercise program. HEP is home exercise program. So they're automated online programs, teach them this, do these 3 things. I'll check back with you in a couple days and make sure they're on track and everything's taken care of and they're not going to get worse or be worse. A lot of these musculoskeletal problems, if they're dealt with right up front, only need this level of care. Okay, they don't need all the other stuff because you're going to avoid what's making it worse. If your neck's bothering you, move your monitor up higher. All kinds of little tips and tricks and things that can be done to stop the progression of the injury, and very often to allow the body to heal and recover before you make it worse. Now, if they get somebody in this visit here that needs direct care, well, that's what these are. They can refer them back to in-person or through telehealth treatment with a full plan of care, any other any other therapy, refer them to the right physician. Okay, that might be a surgeon. They might not be a surgical candidate. Might need a podiatrist consult or a psychologist consult or nutritionist or you name it. But you can get them into these people. And the advantage of working with a PT group, a physio group in your area is they're going to have these relationships already in place. And when um, they call up and say, hey, I've got somebody for you, or tell them that we told you to call, these folks who are part of their network and have trusting relationships with are going to get that person in quicker. And they're going to know that if I'm referring to a surgeon, there's a higher likelihood that they're actually a surgical candidate than if they were sent by a primary care doc or a, urgent care physician or somebody like that. So the surgeon is going to be more eager to see them and see them more quickly. You again circumvent or short circuit that length of care and length of time to get to care episode. And you also eliminate a whole lot of unnecessary tests that happen along the way. Um, because if the surgeon then wants an x-ray or an MRI or something else, they can order that and they can do it, but you're not going to put them in a pipeline with a whole bunch of spending before they ever get to the right person. And they get them to the right person earlier in the process. And that's going to lead to, this is your new timeline down here. If they can get in 1 or 2 days and treatment's needed in a couple days, they can get them into one of these specialists and get them into the surgeon in a week or two instead of 4 to 6 or 8 weeks. Um, that's going to shorten their length of care, their episode, the severity, the chronicity of all of that. And the benefits to you as an employer are huge. And not just you as the employer, by the way. The employer wins, the employee wins, the providers win. Okay. And you know that 27 cents of each dollar that you spend on these healthcare things actually get to the provider as it stands right now, which is insane. 73% is going somewhere else. You can ask them where it is, but um, if you get people in contact with a provider earlier in the process, get them to the right person or get them to a person who can then get them to the right person quicker, you're going to decrease the length of time that it takes. You're going to create happier people. So you're going to save a ton of money. Okay. Again, that $1 million a month, you're going to save $100,000 a month if you do this right. Okay. And again, we've got the stats to show it, the pilots. This isn't made up stuff. You'll have happier and productive employees, right? Fewer lost days because they're quicker to care. They're not going to miss as much. They get to know what to do about the situation. Even, by the way, even if they're being referred to one of these people, they get some tips and tricks and advice to manage whatever it is until then. And even if the stuff they do, by the way, from a clinical standpoint, even if the stuff they're given doesn't work, when they get to one of these people, that's additional information for them that they wouldn't have otherwise had. That will help them make a better diagnosis and better clinical decisions and know what to do next. Okay, so again, speeds everything up. Even if the problem's in the blood, a significant percentage of them, get referrals to a vetted network when it's needed. You've got an opportunity, which we didn't even mention over here, of wellness and injury prevention. So classes, trainings, other things, because you can, when you have this relationship with this provider group over here, they have the knowledge base to do this stuff too. Okay. So if you wanted them to come in and teach your people about how to lift or how to set up their desks or how to set up their home workstations so they're not getting, wrist issues, tingling in their arms, neck problems, or whatever, they have the expertise to do that. You just got to ask them. Okay. That usually would probably be an additional offering beyond this, but fewer injections and drugs, right? Opioids are still a crisis that we're not really talking about so much, but instead of getting them on painkillers and stuff, you're giving them real things, actionable items they can use quicker. And for you at the employer side, fixed costs. Okay, you've taken a lot of the risk out of it. You can figure out with the provider what that's going to cost and set up a straight up subscription model, or at least up into a certain point. So you could pay them a flat rate. And let's say you're, looking at saving that $100,000 a month, and you can test it out. I mean, you got to figure out and see if it's going to work, but you might need to spend $5,000 to $10,000 to get that $100,000 savings. Okay. I know that nobody wants to spend more money and risk it, but set it up so there's a guarantee. Because if they're doing their job, they're doing it well, and your employees are taking advantage of it. And if you're running those programs, you can tell them that they have to do this before they're allowed to go on to a surgeon or whoever, right? You can tell them do this first. You can make sure they're following the right clinical pathways. You can bake that into the system for yourselves, and then really uh, just short circuit, jump over, and eliminate a ton of expenses that you're currently spending. Okay, hope that helps. I'm Sturdy McKee. I do business coaching, advising, training. Usually working more on leadership development, executive coaching stuff, but this is one of those things that's come up in the revenue models and potentials that is just bugging me, and I want you to know about it. So I hope that's useful. Thanks.